Welcome back to Mapping Healthcare on KDRT 95.7 FM in Davis, California, where a medic with a map explores healthcare around the world, highlights people who improve it, and shares what we can learn from them. This is your host, Dr. Sheikh. Imagine this for a second. The most commonly diagnosed cancer globally and the leading cause of cancer death in women, having outcomes that are just drastically different based purely on where you happen to live. That's not some far-off scenario. It's the reality of breast cancer right now. There are countries that have seen amazing progress. We're talking 40% fewer deaths in the past 4 decades, 5-year survival rates over 90%. But some parts of the world face much higher mortality rates, with about half of the women diagnosed with breast cancer dying of it. That's a huge gap. In today's episode of Mapping Healthcare, we're going to dig into these disparities, and we'll look at an initiative that's working to bridge what really is a life or death divide. What's truly fascinating is how much this challenge isn't just a medical one. It's deeply entangled with social factors, cultural norms, and economics. So our mission today is to unpack the complex factors that go into breast cancer screening and ways to tackle this global problem. The numbers paint a stark picture of the scale of breast cancer. In 1 year alone, there are over 2 million new cases and 600,000 deaths from female breast cancer worldwide. This makes breast cancer the second most common cancer overall and the most common cancer among women. And if things just continue as they are, by 2050 we could be looking at 3 million new cases a year. What are the main drivers behind these numbers? A huge factor is late-stage diagnosis, just getting diagnosed too late. More than half of breast cancer cases are already localized or advanced or even metastatic when they're first found. So it's not just about getting to a doctor, it's getting there early and then having the right system to handle the issue when you do get there. And then beyond those clinical things, you have economic and social factors playing a role. Not having health coverage, high out-of-pocket costs. This can stop women from even seeking a diagnosis or treatment that could save their lives. And this is especially tough in places where women might not be the main person deciding how household money gets spent. There are also social, cultural, or religious beliefs or customs that could be hidden roadblocks. Studies have looked at fatalism, a belief that getting cancer is basically a death sentence that is predetermined. Modesty is a barrier in cultures where women may feel embarrassed about exposing their bodies during a mammogram. There is the role of spousal support in determining if a woman gets a clinical breast exam or a mammogram. And there are cultures where there's stigma and taboo around breast cancer. The key takeaway is how these really personal beliefs or family situations can become silent, invisible barriers. And then there are workforce or infrastructure factors. Lack of publicly funded clinics, not enough skilled staff like radiologists or pathologists. All of this can lead to wrong diagnoses, or maybe too much or too little treatment, and definitely big delays in getting treatment started. Screening recommendations for people who are trans are tailored based on hormone therapy or risk factors. That research is still ongoing, and clinician knowledge gaps and attitudes could lead to disparities in care. These are deep-rooted issues that impact every single step for a patient, from personal beliefs right up to the structure of the health system. Our guest in today's episode of Mapping Healthcare is Salma Jaouni Araj, CEO of the Healthcare Accreditation Council in Jordan. Salma and I talk about the Jordan Breast Cancer Program, why it was set up, and how it implements early detection to reduce deaths from breast cancer in Jordan. The views expressed on this show are mine and those of my guests. So Salma, welcome to Mapping Healthcare. You live and work in Jordan, where you are the CEO of Healthcare Accreditation Council in its capital city of Amman. To help set the stage for our conversation today, tell us a little bit about the healthcare system in Jordan, just some basic information on how it is structured and financed.
Thank you, Olfat, for having me. It's a pleasure to be talking to you, and it's also an honor to be representing Jordan and telling you a little bit about our healthcare system. Jordan is a lower middle income country. Our healthcare system has been very strong, divided between public sector healthcare services offered by the government, as well as military healthcare services, and the private sector, with some of the nonprofits also playing and having actually a big role in many healthcare services provisions. We've been doing very well in terms of numbers and indicators reported to WHO and to the World Bank in terms of number of physicians attending to births, decreased mortality rate, maternal mortality, and so on and so forth. However, Jordan grew very quickly due to many of the political situations in its neighboring countries. And we've had a surge of number of refugees, and the population grew. And Jordan has always been very supportive and welcoming of all our guests. And as a host country, we extended our both education and healthcare services to all the residents in Jordan, which unfortunately, being a lower middle income country, has definitely taken a toll on the burden of number of people visiting our healthcare services and the budget, of course, and of course, indirectly on the quality of healthcare services. More than 80% of the population either gets healthcare services from the Ministry of Health, which runs around 33 hospitals and more than 800 primary healthcare centers. And only around 20% go to the private sector. So this is the structure and format in a nutshell.
The structure you describe, it's complex, but it's a structure that's seen in many countries. You've served in roles which have given you a really good view of what works well in your health system. So you previously served as the senior advisor to the Prime Minister of Jordan on public and social policy. So that gives you a good view into the strengths of the health system in Jordan. And you've also touched on some of the challenges of your environment. And you've had a chance to experience health systems in many parts of the world in addition to Jordan. You've lived and studied in the United States and the United Kingdom, and so you have a comparative look at challenges in different healthcare systems. So let's jump right into the topic of this episode, which is breast cancer screening. We'll talk about a breast cancer screening initiative that you were involved in Jordan. So you were the founding director and the manager of the Jordan Breast Cancer Program for 4 years. And this is a nationwide program which was established in 2007 and is supported by the King Hussein Cancer Foundation and Center and the Ministry of Health. And the goal of this program is to develop and provide comprehensive services for the early detection and screening of breast cancer for all women in Jordan. So tell us about your career journey that prepared you for this role.
In my undergrad studies, I did environmental health and public health, which included health services administration, as well as communication, behavioral change in health. And then I studied health systems and went for my master's in public policy. And in all those academic backgrounds, when I applied for jobs, I ended up somewhere working in a combination of the health sector or the development sector, along with policy change and so on, which is beautiful to be able to really think at the national level, but to develop things that are practical and implementable. That's where my heart was. And when I came to Jordan after working in consulting in the region and having finished my master's degree, this position was open. And when you say the stars align for it, they did. But there was also something very deep in my heart. I lost my mother to breast cancer, which metastasized to the lungs very early on when I was only 23. And she was very young as well. I mean, she was 63. And that topic was, in cancer in general, was something very new, hard to navigate, very costly. And really, though I was living in Lebanon at the time, but the whole region was not aware about the importance of screening, early detection. Jordan also had lost His Majesty King Hussein to cancer. And His Majesty King Abdullah had transformed what used to be Al Amal Hospital for Cancer into the King Hussein Cancer Center and Foundation, and entrusted it to two of the royal family members to take it on as a not-for-profit organization. It's a gem, not just for Jordan, but for the whole region. It's a referral center. They had worked so much on the treatment side, but at the time in 2007, the numbers they were getting in relation to breast cancer were alarming because they were all stage 3 and 4. And a woman would arrive in really devastating situations with lumps and oozing. And they would look at these young females having to be lost to their families because of that, and decided to establish a national program along with the Ministry of Health, hand in hand, to address those issues. As in any part of the world, it is typical that the topic is a hush-hush, right? We don't talk about cancer. When it comes to females, it's even harder because if she's a mother, her daughters might not get married because she has breast cancer. She might get divorced if her husband finds out. All those stigmas that are all over the world were playing into a woman's inability to come forward and say, there's something in my breast, let's check it out. The other part was that we were seeing a lot of younger women in their 40s and even below 40s with these types of breast cancer. And third, we really didn't have screening services accessible all around. And even before screening per se, I mean, early detection, even the notions of self-breast examination and clinical breast examination to get to know your body, get to see the changes, be aware of all of those things were non-existent. And that was really the aim of establishing the Jordan Breast Cancer Program.
You touched on some really important challenges related to breast cancer screening in Jordan that this program had to tackle. You mentioned setting up a whole program, communicating with people, overcoming stigma, overcoming current practices. And really, I can see how your preparation and health policy, learning about communication skills, your own personal story really fueled this work of your team and has kept it going in a highly sustainable program. When the program was being started in Jordan, I read that more than 70% of breast cancer cases in Jordan were being detected at advanced stages of the disease, so stage 3 and stage 4. And because of this, breast cancer survival rates were low and treatment costs were high in Jordan because of these advanced stages of cancer that patients were coming in with. So some of the challenges related to breast cancer screening in Jordan are really seen worldwide, and your team looked at these challenges and developed some interventions and components of this program that specifically address these issues. So this program was established in 2007 and it's been around now for almost 2 decades. What were some of the key components of the Jordan Breast Cancer Program which led to some of its successes?
The first thing that we looked at, we wanted to raise awareness about breast cancer, about the signs, the importance of early detection, coming to your healthcare provider as early as possible when you notice any change, all the science behind awareness and behavioral change. And October was around the corner at the time, and we launched our first October campaign and started talking about it with a lot of pushback. I got calls from reporters, I recall, saying, in our face, you want to put breast cancer out there in newspapers and so on. This is very hard on us. It's not. And you would see how things were playing. But that was a national campaign, and we had a lot of reaction. Social media wasn't still as strong as it is today. So we went into traditional media, billboards, roadshows, TV interviews and activities and so on. And we started doing more and more outreach. In that outreach, we recruited a lot of midwives who are already out there, who had already very strong relationships with the women, with visiting homes or family planning, reproductive health, you name it. And we introduced all the things related to breast cancer in that manner. But then, okay, we're asking all these people to be very aware, but who's going to really actually check them out, tell them what to do, refer them, what's next? So we opened the second component, which was strengthening the services, making sure that primary healthcare centers are well equipped, they have mammograms, or they can transfer people to mammography for their screening or for their breast imaging. Now things started boiling up and one thing coming after the other or during the other. Oh, we need breast cancer screening guidelines. So we designed the first ever set in the whole region for breast cancer screening guidelines. I remember crunching them late in the night, building them on, of course, international best practices and so on. And we launched that, developing a lot of tools that educators can utilize. And then said, radiographers and radiologists. Early detection is easy. You see the lump, you move it on to pathology, et cetera, et cetera. But screening is about detecting the difference between last year's image and this year's image when it's smaller than the head of a pin. Are our radiologists trained for that? We looked into the system, we identified the weaknesses, and we launched a huge upskilling program. And the beautiful thing was seeing really top-notch radiologists who have been number one in Jordan, joining those classes that we ran with international expertise and those images and imaging that they had to read to really become competent in screening. And then came the issue of quality. And what does a mammography unit and a breast imaging program require to ensure its quality? The training of the people running it, the referral system, the maintenance of the machines, the infection control, all those components. And at the time, we went to the healthcare accreditation councils and we went to them and said, we want a program for breast imaging units that is an accreditation system that is a stamp of quality and patient safety. And they designed that program, and it's a beautiful program that lends a stamp of quality to breast imaging units so that in our campaigns, we tell people, go to breast imaging, look for that stamp to make sure that you are receiving comprehensive, high-quality services. So all of those things came in play, and we worked on them one by one. I was honored to be with the team for 4 years before I moved to the Prime Minister's office. And then they took it way beyond those baby steps that we had started together.
Yeah, that is quite a journey, Salma. You started in October, Breast Cancer Awareness Month, which has been celebrated since the 80s. Then it's called Pink October because people around the world adopt this color. They wear a pink ribbon to raise awareness. So your program took advantage of the conversation worldwide around breast cancer to launch the program. And you also mentioned a really important aspect of successful screening programs that played a role. So you mentioned that early detection is just one component of the equation. It's a good place to start. But unless you have those referral units, those resources for follow-up, quality assurance programs that have mechanisms to minimize potential risks of screening, patient education, all of those components need to go into a successful and sustainable screening program. So I can see how thoughtfully your team went about designing the Jordan Breast Cancer Program. You helped set up that program, and now you work in the accreditation field in Jordan. So you've been CEO of the Healthcare Accreditation Council in Jordan since 2012. You have a master's degree in public administration from the Harvard Kennedy School. You also have a postgraduate diploma in health systems management from the School of Hygiene and Tropical Medicine at the University of London. And as part of this training in the US and UK, as well as your work in the Middle East, and you've also volunteered with the International Society for Quality in Healthcare, you've had a chance to interact with health systems in many parts of the world. So, what are some lessons you have for current and future healthcare improvers that you've picked up over the years from your own work in health administration?
Wherever we are in the world, we're trying to uphold an oath to improve people's lives and save them. So, one, we should never try to reinvent the wheel. If there are success stories around the world, we need to be very cooperative and support each other across borders to implement them. We always bump into, oh, but there are no funds to do this program. We started the Jordan Breast Cancer Program with minimal funds. Today, it's very well funded all over the country and well established. So it's about starting. Third, it's people. We have been losing compassion and empathy in the health sector. I do agree that running the healthcare system, we have to run it like a business for it to be sustainable and for it to be effective and cost efficient and all of that. I 100% agree. But there's a component that's different than any other business, which is empathy and compassion. We're dealing with people's lives. We're dealing with people who come to us not because they want to buy something, but because they are burdened with something. With that all aside, we are all not doing well. We are all not focusing on primary healthcare. All of us worldwide. We really, really, really need to focus on primary healthcare. We've just done that in the economic modernization vision of His Majesty for Jordan for 2030, and I hope we move forward on it. But the definition of primary healthcare, not just from accessibility, but the services we offer, the strength of it, and making people confident about it is what we need to focus on as well.
Thanks for wrapping up with primary care, because that is where the screening programs are housed, and primary care strengthening is a definite initial step in building everything else that goes with a strong healthcare system. So, Salma, we conclude each episode of Mapping Healthcare by learning just a little bit about the place our guest comes from. And you live and work in Amman, which is the capital of Jordan, an Arab nation in West Asia. Jordan is famous for its ancient monuments, its nature reserves, and its seaside resorts, and it's home to the archaeological site of Petra, which dates back to 300 BC. And pictures of Petra that I've seen are stunning. It has temples and monuments carved into pink sandstone cliffs, which give this ancient city its nickname, the Rose City. So that's definitely on my list of things to explore. But tell us about a couple of places or experiences in Jordan a person unfamiliar with the area should check out.
That's another half an hour. There's a lot to see in Jordan. First of all, the whole country from north to south is a 4-hour drive. You mentioned Petra. We also have Wadi Rum. It's the desert where you can do camping, stargazing, sand dunes, and all of that. And that's all towards the south of Jordan. Along with Aqaba, we have the richest, most southern coral reefs for those who love diving and snorkeling and the sea. More central in the capital and up north, you will find Roman ruins to visit and a lot of nature for hiking. And then all of that aside, if we're not talking pure tourism, the most important thing is the nature of the people, their hospitality, and the food. I mean, we have exquisite dishes. Make sure that you lose some weight before you come because you're going to gain it. Over here, Amman has a lot to offer, that combination of a modern city with the way its buildings are set up in white stone. Everything is very accessible. Everyone speaks English on top of course, our native Arabic language. And I don't think I've seen someone who's come here who didn't want to come back.
A combination of dunes, deserts, and diving, all within a 4-hour drive of each other. Warm people and no language barriers sounds like a dream come true. So thank you for sharing a little bit of information about the amazing part of the world that you live and work in. And Salma, it was such a pleasure to talk to you today and to highlight the amazing work of the Jordan Breast Cancer Program that you and your team built 2 decades ago, and that's still growing strong, detecting breast cancer and saving lives till this date.
Thank you for having me.
That was Salma Jaouni Araj telling us about the work of the Jordan Breast Cancer Program over the past 2 decades and the social, cultural, and economic factors that play a role in breast cancer screening. It's not only about having the absolute latest, fanciest screening devices and treatments. There's more going on. The World Health Organization's Global Breast Cancer Initiative provides a roadmap for countries. It's built around 3 pillars. Pillar 1 is about health promotion for early detection. The strategies here are broad public education about risk factors, about symptoms to look out for. It emphasizes breast self-exam, helping people know what's normal for their own body. This is vital because in many countries, 90% of breast cancers are actually first found by the women themselves. The second tool is clinical breast assessment. This is where a clinician takes a history and does a clinical breast exam. In many parts of the world, these 2 basic steps need to be in place before we can even talk about screening mammography. Culturally sensitive outreach through existing community resources helps get the word out. Salma spoke about midwives in Jordan helping with breast cancer screening. In the United States, outreach that includes community centers, social service agencies, workplaces, senior centers, and religious centers has been shown to improve screening rates. Pillar 2 focuses on timely breast diagnostics. This covers the time between someone showing up with a potential symptom and actually getting a confirmed diagnosis. If treatment doesn't start within 3 months of first presenting with symptoms, survival rates start to drop. And for this, everyone needs to work together: radiologists, pathologists, surgeons. Pillar 3 is about comprehensive breast cancer management. This covers the time when patients get through their planned treatment without stopping it due to side effects or financial constraints. Beyond actual cancer treatments, you need services to help patients stick with treatment and support their overall well-being. Psychological support, pain management, physiotherapy, these aren't extras. They're vital right through the whole journey. We've come so far, but there's still a long way to go. Thanks for tuning in. This was your host, Dr. Sheikh. You were listening to Mapping Healthcare on KDRT 95.7 FM. Please connect with the show on Instagram at Mapping Healthcare to share your thoughts and ideas for future episodes or guests. You can hear Mapping Healthcare around the world anytime on kdrt.org and wherever you get your podcasts. If you enjoyed this episode, please don't forget to subscribe and leave a review.